Good evening, everyone. You're welcome to today's Limi Instagram Live, and it's an educational forum that we discuss common medical conditions, and it helps us to be more aware of the medical conditions and how we manage them within the hospital. Today, I am Dr. Igbokwe, LC, your personal physician, and with me is
Dr. Ogoke, consultant, obstetrician gynecologist with Limi.
Oh, you're welcome to this Instagram lifestyle. So we're going to be discussing a very common medical condition that affects a lot of women. And the name of this condition is called dysmenorrhea. I know that you are here on this Instagram live and you want to find out many more about dysmenorrhea, and that's what we're going to discuss today. So, sir, can you tell us what is dysmenorrhea?
Who have given the medical term dysmenorrhea many names. Some people say it's painful menstruation.
Okay.
Some people say pain of menses, and some people just call it lower abdominal cramps. But correctly put, dysmenorrhea is the medical term for pain, for lower abdominal cramps during menstruation.
Okay.
And it's a very common condition, like you said. Worldwide, the reported incidence or prevalence of dysmenorrhea ranges from about 50 to up to 94% being reported by some studies. But closer home in Africa, studies have reported about between 41 to 94%. While in sub-Saharan Africa, incidences that have been reported will range from 51 to about 88.1%. But the general thing is that of all these percentage of women that report pain during menstruation, about 29% of them report a severe form of the pain. And of the reported 50% of them that will need medical help, only about 20% or close to 30 at best reported in literature actually seek medical help. And that's not good, because dysmenorrhea is not as simple as people think it is. So many of the causes of dysmenorrhea require medical attention and treatment.
Wow, that's really impressive. The statistics of this condition really looks very significant worldwide. Now, I want to ask you a question. Is every menstrual pain normal? Are there circumstances where menstrual pain is not actually caused by a normal condition?
Okay, if you look at dysmenorrhea can be classified into two.
Okay.
It can be primary dysmenorrhea or secondary dysmenorrhea. But giving a direct answer to your question before I go further to explain what primary dysmenorrhea is and what secondary dysmenorrhea is, the direct answer to your question is no. Not every menstrual pain should be considered normal. In fact, majority of menstrual pain is normal. The majority of menstrual pain are not normal. Then primary dysmenorrhea refers to dysmenorrhea without any primary problem or any pathology or any disease condition affecting the female genital tract. Most primary dysmenorrhea, in fact, one of the ways of knowing, if you understand the nature of the pain you feel during your menses, and if you study it, you can tell when you need to seek medical help or not. One thing about primary dysmenorrhea is the general features to help know when your dysmenorrhea is primary dysmenorrhea is that most primary dysmenorrhea starts a little before actual menstrual bleeding starts. Some people say most times 12 to 24 hours before the actual menstrual bleeding starts. And from that time, it continues to decline. It continues to decline, quite unlike the other, which is due to a disease condition of the female genital tract, which can increase as the menses progresses. And another thing about to know primary dysmenorrhea is that its onset, it starts around the time the person starts seeing the first menses, or around the time the person attends menarche.
Okay.
And then it declines. That's the severity of the pain keeps reducing as the person ages. And most times after the first delivery, it can stop.
Okay, thank you very
And
much.
then primary dysmenorrhea is also important to know that primary dysmenorrhea may be associated with some other symptoms, but these symptoms are usually mild, like lower abdominal discomfort, even diarrhea, and then sometimes very mild headache can be associated with primary dysmenorrhea. But in secondary dysmenorrhea, which is dysmenorrhea due to a pathology or an infection or a disease condition affecting the female genital tract.
Okay, so just to recap what you said primary dysmenorrhea when there's no problem with the woman, like her organs.
Yes,
So
there is no disease
there isn't
or
any disease
condition
compared to secondary.
affecting the female genital tract.
And this pain comes like 12 to 5 before the menses, and it reduces as
It
the
keeps
menses.
declining,
Okay,
yes.
so that's very, very important. So let's talk about secondary dysmenorrhea. What's the other about?
Okay, secondary dysmenorrhea is painful menstruation that is due to a disease condition or an infection affecting the female genital tract. Secondary dysmenorrhea usually may start days before the onset of menses, and with the commencement or the onset of actual menstrual bleeding, it continues to increase, quite unlike primary dysmenorrhea, when you have the pain declining, and then most times it may be associated with other symptoms relating to the female genital tract, like abnormal vaginal discharge, abnormal vaginal bleeding, or even heavier menstrual flow. Heavier menstrual flow. And then there are known common causes.
Can you show us some of these causes?
There are known common causes, like in our environment, you have there's endometriosis, which is usually underreported, and some people with this condition are asymptomatic or might misinterpret the dysmenorrhea they have as primary dysmenorrhea. And that is why it's important to emphasize that once you have menstrual pain, it is not, once you have menstrual pain, enough to affect your daily activities, because majority of primary dysmenorrhea does not impair you from performing your normal daily activities. But once your menstrual cramps begin to impair you from or begin to affect your normal daily activities, it is important to seek medical help at that point. And I've talked about endometriosis, another common cause is adenomyosis, and even uterine fibroid, depending on the size and the site of the fibroids. And then a very important cause in our environment is pelvic infection, notably pelvic inflammatory disease. And then less commonly, other congenital abnormalities of the female genital tract, like cervical stenosis. And let me just say a few things about it. In cervical stenosis, the tract through which the menstrual, that's the blood that comes out and reveals what we normally, some people call menses, through which the menstrual comes, that tract through the cervical canal, that tract is abnormally narrow. So that condition, can be congenital and is called cervical stenosis.
So the secondary dysmenorrhea, like you said, it's about a disease or infection of the female genital tract. Now, the female genital tract, let me just clear that, involves the uterus, the cervix, which is the neck of the womb, the fallopian tubes, and even the ovary sometimes, and the vagina itself. So just to be clear, when you say female genital tract, so we are able to carry everybody along on what female genital tract is. Now, I want to find out, is there anything that will make someone more likely to have menstrual cramps more than every other person? Like most ladies,
Okay, thank you for that question. It's just like asking, is there a direct cause of menstrual or dysmenorrhea? I've mentioned for the second one, you have direct causes,
Yeah.
known causes which I've mentioned like endometriosis and others. But when you talk about primary dysmenorrhea, now, let's come to primary dysmenorrhea. There is no pathology or no primary disease affecting the female genital tract. But there are certain things that have been associated in literature with the increased likelihood of having primary dysmenorrhea, like age under 20 years. Like I said, you know, remember when I talked about primary dysmenorrhea, I said it declines or reduces with increasing age. So people under the age of 20 years, and then cigarette smoking increases, you know, this even not only makes you more likely, but increases the severity of the pain. And then even consumption of caffeine, and then some other conditions like depression, and then when there is anxiety, and then people might want to ask for primary dysmenorrhea whether there is a genetic predisposition, but
Yes,
there is none. I know you may want to ask that. There is none except for those causes of secondary dysmenorrhea in which there are genetic predisposition to having those conditions which present
so
as
a mother
dysmenorrhea.
can actually have pain during her menses and her children will not have. So that's
Yes, if it is primary.
yes, if it is
If
primary.
it is primary, yes, yes,
Um,
yes, and something very important I want to say at this juncture, not in response to your past question. I just want to, you know, raise awareness of our viewers that, you know, we've described primary dysmenorrhea. We said the pain starts usually a few hours or some hours before the onset of menses and keeps declining. But there is something I want us to know. Once some people can have primary dysmenorrhea, and at a point there is a disease condition or there is a problem with the female genital tract, which now makes your ab initio primary dysmenorrhea not normal anymore. So once you know over time, the woman gets to know what degree of pain she has during her menses or what degree of cramps to expect. Once you notice an increase, a worsening form of primary dysmenorrhea, it's very, very important that
she set an alarm.
should set an alarm, and it's very important that such a woman should seek medical help. And then other conditions or other situations in which a woman with primary dysmenorrhea should seek medical help. Once the associated symptoms like diarrhea becomes more severe, or even your menstrual flow increases and becomes heavier, and there is, you know, dysmenorrhea associated, such should make a woman, you know, seek help.
So it's always important to note the severity of the menstrual pain in yourself, so that if it's getting worse or if you see other symptoms like heavier menstrual flow, you should set an alarm and you should see your doctor. Is that right?
In fact, in furtherance to you know, my earlier point, some authorities or some people, some obstetricians or gynecologists believe that a woman on her own should not term her menstrual cramps primary.
Okay.
It's after you sought help and it has been found that there is there is no disease condition affecting your genital tract. Then one can boldly say, these mild cramps that I have is primary dysmenorrhea.
So it's a secondary to proving otherwise.
Not in the, you know, not in the clear face meaning of that statement. But what I'm trying to say is that it's safer to seek medical help, and they say there is no problem other than to stay with your dysmenorrhea, and maybe when it gets bad and you now seek help, you know, people will be the health workers or caregivers will be saying, why didn't you present earlier? The cause of this dysmenorrhea has gotten to a stage where treatment will be more difficult.
So it's important that every girl, every female in reproductive age that has this pain and should come to the hospital to be sure that
assessed. Yes.
It is not
especially in our environment.
Yes, especially in our environment. Thank you very much, sir. Okay, so we've talked about menstrual pain. Is there anything, what makes this menstrual pain abnormal? Is there anything that makes this menstrual pain abnormal?
Okay, like it's just like a repetition of what I described as primary dysmenorrhea.
Yes.
That it starts and it continues to decline.
Right.
And then another important thing to note is that onset, it starts a few months after a few cycles of attending menarche. And some people start having primary dysmenorrhea or menstrual cramps right from onset of menses, and it keeps declining. But when you start seeing features like some associated the associated symptoms, like I said, the menstrual bleed
Yes.
gets severe,
Yes.
your non-primary dysmenorrhea gets more severe
Yes.
or gets worse to the extent that it impedes you from performing your
Daily
normal
activity.
daily activities. You should seek help. And then when you notice other genital tract problems, like if you have a lower abdominal mass, and and then some women might even know that they already have a primary problem before the onset of it. If you are known, or if you know, like for instance, people may have done ultrasound either for other reasons or even for investigation of other genital tract problems, and you may have been told you have fibroid, and then you now notice that your menstrual pain has worsened, or you were not having menstrual pain before now, and you have such are the situations in which you should know that the menstrual cramps you have is not likely to be considered normal, or it's not likely to be normal, and it should make you seek medical attention.
Thank you very much, sir. Sir, I'm a lady, and I know that there are a lot of women of reproductive age group right now that will be asking this same question I'm about to ask. If, as a lady, and I have a menstrual pain, and I come to the hospital, I want to know what will be done for me when I come to the hospital.
Okay, that's a very nice question. So that you'll be harmed and you know
Yes,
what to expect. You want to know what to
Yes.
expect. Okay, for general clinical evaluation of a woman who presents with complaints of pain and full menstruation, just like both, not dysmenorrhea now, painful menstruation,
Yes.
just like people generally call it.
Yes.
The caregiver or the doctor or even the obstetrician gynecologist, whoever, would want to know your age,
Okay.
and would want to have some of your general demographic data, and then would also want to know what's your parity. Many children have you had?
So parity
How
means
many
how many
children have you had? How many deliveries?
Okay, how many deliveries
Have you had? And then how many deliveries, like I said, and then are there other gestational events that did not lead to delivery,
Okay.
like miscarriages or termination of pregnancies?
Yes.
The doctor would also want to know what's your age, very important,
Your present age.
your present age, and then the doctor would also want to know at what age did you attend menarche.
So menarche means the first time.
The first time one sees menses.
Okay.
What age? It's a very, very important event in a woman's life. In fact, I advise all our viewers, it's important you note that age.
Celebrate.
You do not forget the age at which you had your first menses. Very, very important.
A lot of women forget.
Because they don't consider it very, very, and I'm telling them now that in the evaluation of dysmenorrhea is a very, very important. In fact, in all gynecological consultations, it's a very, very important information. So every woman should endeavor to know her age at menarche. And then, very importantly, at what age or what time did you start experiencing this menstrual pain? Right from the time you started seeing menses. If not, how long did it take for you to start experiencing the menstrual pain? And then, how severe has it been? Is it more severe now? Is it less severe now? So every caregiver would want to know how severe. And then, are there associated symptoms, like I said, like diarrhea, abdominal pain. And then it's important to mention at this point, okay, maybe I'll mention it later, something very, very severe that very few women may have. I will mention it, but it's important that especially for women that use tampons. And then the doctor would also want to know how is this pain related to, what's the relationship? How does this menstrual cramp fare with your menses? By that I mean, at what time does it start? Does it start before your menstrual bleed starts? And if so, how long do you experience this pain before the actual menstrual bleeding starts? And then once the menstrual bleeding starts, how does the pain progress with the menstrual bleeding? Does it, abate with onset and progression of the menstrual bleeding, or does it keep on increasing? And then does it outlive the menstrual bleeding? By outlive, when the menstrual bleeding stops, does the pain continue? And then the doctor would also know, are you known to have some other pathologies before now? And then of course, the doctor would want to also know a bit of your social history, like alcohol intake, and then smoking. And then the doctor would also want to know, are there other coexisting medical conditions? And then, very importantly, like I said, I want to leave it for the later. I said it's important to know that if you have dysmenorrhea, menstrual cramps, and you are someone that uses tampons, if you are having it and it outlives or stays beyond your menstrual bleed, and then there is fever, there is severe diarrhea, and there is feeling of fainting, that may be a sign of a very severe medical condition called toxic shock syndrome, which is usually associated with forgotten tampons.
Okay, forgotten tampons. So
yes.
If a woman has a menstrual flow, but she now starts having fever,
in fact, the person should seek medical help as soon as possible. As soon as possible.
That's very, very enlightening.
As soon as possible.
Yeah. So, ladies, when you are coming to the hospital and you want to,
these are the things you should
arm yourself with.
And then, in terms of examination, the doctor would want to examine you generally. The doctor would want to check if you have fever. The doctor would want to, look at your body physically, and then the doctor would want to also know, the doctor would want to examine your abdomen. The doctor would want to know where the pain is, and the doctor would want to, in that abdominal examination, the doctor would want to check, are there abdominal mass? Is there an abdominal mass? And then, is the site of pain, and in the first instance, is the pain really lower abdominal pain? If it is, and there are other things associated, and then the doctor may want to do a vaginal examination. And then, in that notable speculum exam, in which the doctor would use a small instrument inserted into the vagina and look at the cervix. Like I said, cervical stenosis is one of the common causes of secondary dysmenorrhea. And then the doctor may want to examine other systems of the body as the case may be. Then the doctor may also want to request some investigations, and these investigations usually depends on what the doctor has found during the interaction with you and during the examination.
So what are these common investigations that are?
Okay, specifically for generally and specifically for dysmenorrhea, the doctor may want to do an ultrasound. The doctor would want to do a pelvic ultrasound or an abdominal pelvic ultrasound, as the case may be. And then in certain conditions or certain situations where the doctor suspected, the doctor might want to recommend a more invasive investigations like laparoscopy. But that is not to say that there are very general investigations that are done for people presenting to the hospital with complaints of dysmenorrhea, like your complete blood count, especially for those that have associated symptoms like excessive menstrual bleeding. The doctor might want to do a complete blood count, and then the doctor, for those with abnormal vaginal discharge, like I said, pelvic inflammatory disease and pelvic infections is a known cause of secondary dysmenorrhea. So the doctor might want to do a high vaginal swab and or endocervical swab for microscopic culture and sensitivity. And then the doctor might want to even do a much more further investigations, much further radiological investigations like a magnetic resonance imaging where adenomyosis, if adenomyosis is suspected. And then for congenital uterine abnormalities, apart from ultrasound scan, one may want to also do a hysterogram, just like the general hysteroscopy program we know. But this one, the aim is not to outline the tooth, but this time is to outline the uterine cavity and the other parts of
this hysterogram is a special test. Yes, to outline
the inner part of the uterus and then the cervix and the distal rest of the female genital tract. And then other investigations, apart from the ones I've mentioned, can also be done depending on what the doctor suspects might be the cause of, the dysmenorrhea or the secondary dysmenorrhea.
Thank you very much, sir. This has really been very interesting so far. Now, let's talk about treatment. Like, what are the possible treatment modalities for menstrual?
Okay, generally, I would say there is medical treatment and there are alternative treatments. I know that most people would want to hear about the alternative treatment, but I would like to start with the one that is small, which is the medical treatment. Because the medical treatment of dysmenorrhea, in fact, I want to say that the first line is in the medical treatment is the use of non-steroidal anti-inflammatory drugs like Avoflovin, Igbokwe, diclofenac, popularly known as cataflam, and all that. And I want to say these drugs have been seriously abused for the purposes of treating dysmenorrhea. And that's why I said earlier that once your pain during menses increases from what you used to know, please seek medical attention. Please seek medical attention, very important. Because these drugs, the non-steroidal anti-inflammatory drugs, when abused, have very serious side effects. They can even cause peptic ulcer disease and can even cause upper gastrointestinal bleeds, which can make the person vomit blood or even have the dark risk to what we call melena, which signifies that the person is bleeding from a part of the gastrointestinal system that is above the proximal part of the small intestine. So it's not advisable to keep on every month taking Felvin for 5-6 days. It's not advisable. It is better to seek medical help because that helps us to find out, is this dysmenorrhea really primary dysmenorrhea? Because majority of primary dysmenorrhea will not require medications, will not even require medications, and will not prevent you from performing your normal daily activities. So having said that about the use of non-steroidal anti-inflammatory, I want to re-echo again or re-emphasize again, please, let's not keep self-medicating us, giving ourselves diclofenac or cataflam 5 days in a whole month just to treat dysmenorrhea. It's better we come to the hospital, especially the Limi hospital, and have this our primary dysmenorrhea or so-called dysmenorrhea assessed. And then some people or some literature have reported combination of non-steroidal anti-inflammatory with a class of drug, the smooth muscle relaxants, popularly Buscopan. This is another practice in our environment. Once they have dysmenorrhea, they go to the roadside chemist. They can combine, and I've heard over the years, I've heard women tell me about some combinations, and when you talk, they will say, "Doctor, they work. It
You
really
mix
works.
it, you mix
You
it
know, they
together.
mix paracetamol and Buscopan, or they combine Fervin with Buscopan. Or some people, you might even be surprised. Some of our people know about, very strong antispasmodics like Brotavarine. When a woman's menstrual pain gets to the point that you now start knowing the names and combination, please, on a more serious note, we really need to come to hospital to evaluate and know what are we really doing, because some of these causes of dysmenorrhea have serious reproductive implications, like pelvic inflammatory disease can lead to chronic pelvic pain, can even lead to tubal blockade and cause infertility, which you remember the last time I was on this program, I talked about infertility. So please, for us not to cause unintended infertility, that's what I call it, unintended infertility. It is better and cheaper and safer for us to come and evaluate our dysmenorrhea before we cause problems. So other medical measures will include the use of hormonal and hormonal drugs, like commonly the combined oral contraceptive pills, and then let me know you with some other drugs that hormonal drugs that, or the very common and simple one we use is combined oral contraceptive pills, might be useful in the treatment of some of the causes of secondary dysmenorrhea.
So let's
To
do
the
alternatives.
I know you.
Yes.
I know you want to hear what are these alternatives. And then sometimes, let me say, the thing about these alternative measures is that usually you are not able to treat severe forms of dysmenorrhea.
Okay.
They are not severe dysmenorrhea, or let me say secondary dysmenorrhea, or severe forms of primary dysmenorrhea are not amenable to caffeine use, caffeine in various forms, caffeinated drinks, excess of
structural abnormalities with the female genital tract, as well as cervical stenosis. Also, we talked about the likely risk factors for a woman to have a primary dysmenorrhea, and we said the age. And we also talked about smoking, we talked about nutrition. Also, we also dived into the likely treatments, which we mentioned as medical and alternatives. Is there any other thing you would like to tell us?
Okay, very importantly, I wanted to, emphasize. Wanted to emphasize more on endometriosis.
Okay.
Like I said, remember I said in the course of our discussion, underreported.
Now,
and then sometimes even those that have it do not actually know that they have. So endometriosis, I just want to say. Yes, endometriosis. Endometriosis is the presence of the tissue that lines the inner part of the uterus. Its presence in other parts of the body, like the ovary, the fallopian tubes, and then the peritoneal coverings of the pelvic organs.
So that's the linings of the organs. Okay.
Its presence in these sites, which is not, in fact, its presence is in any other site other than the inner parts of the womb.
So why is it a problem?
Yeah, because wherever it is, it responds to the changes in the menstrual cycle, like you see in the inner linings, because it still undergoes this same congestion. That's the increased blood flow, and then also bleeds. So imagine if it occurs in the peritoneum or in the coverings of the pelvic organs,
Okay.
and it is time,
It's time for
there's
menses.
it's time for menses. As the one in the inner uterus is shedding and bleeding, it also
the other places
responds and bleeds and produces menstrual like other parts. So, and it causes very severe pain, scarring of tissues, what we call adhesions, and then can lead to what? Blockage of the tubes, and then formation of cysts in the ovaries and other problems that affect fertility.
So thank you very much, sir. I think that we've really discussed broadly on this topic called dysmenorrhea. And to take home, like you said, it's better to come to the hospital to be evaluated that you don't have secondary dysmenorrhea and go home that it's primary.
Yeah.
That to assume you have primary and there is a secondary cause. Do we have? I think we have some questions today. We have some questions today, and we'll be asking, like, a lot of people have put in their questions that they have to ask. So, once again, I am Dr. Igbokwe, Chisom LC. I'm personal physician at Limi Hospital, and
okay, one of the viewers. Okay, I'm Dr. Ogoke Makama, consultant obstetrician gynecologist with the Limi Hospital.
So if you're just joining us, we are discussing a medical condition which commonly affects a lot of women called dysmenorrhea, also known as menstrual cramps. So some of the questions that have been brought in are, the first one is, what are the symptoms of dysmenorrhea?
Okay, earlier in the course of our discussion, I tried to say, just like, I said, for primary dysmenorrhea, you have lower abdominal pain that starts, some hours before the onset of actual menstrual bleed. Yes. And this lower abdominal pain usually declines or reduces as time, or reduces with, further menstrual bleed. This is because actually what causes it is the congestion and the release of prostaglandins from the endometrium. Remember I talked about the inner lining of the uterus, which is the endometrium. And with shedding, the levels of the prostaglandin, which causes the contraction and the contraction of the uterus, declines. That's why primary dysmenorrhea declines. But in the other, like I said, it may be associated with some other symptoms.
Yes.
Like
said diarrhea.
I said mild diarrhea, and then some mild forms of headaches and all that, and lower abdominal discomfort. Whereas secondary dysmenorrhea will be more severe, might start before the menses, or can even start with actual onset of actual menstrual bleeding, can last after the menstrual bleeding, but does not usually decline with time or with menstrual blood loss, further menstrual blood loss.
So another question that was brought for us today is, what are the risk factors of dysmenorrhea? I think we've handled that. The risk factors include the age, especially primary dysmenorrhea. The risk factors include the age of the lady, mostly less than 20
years.
But also we talked about nulliparity.
Yeah.
Like we also talked about some lifestyle habits like smoking, and also
consumption of caffeine.
Consumption of a lot of caffeine, and also some premorbid
anxiety and depression.
So these are risk factors.
And then those that have pre-existing pelvic problems or pre-existing diseases of the female genital tract.
Thank you very much. So, how is dysmenorrhea diagnosed? Dysmenorrhea is a menstrual pain.
Okay, dysmenorrhea diagnosis. The person actually, I think I can rephrase the question. It says, how do you diagnose the cause of my dysmenorrhea? Because dysmenorrhea is a symptom.
Yes,
it's not a diagnosis, it's a symptom. So how would I know the cause of my dysmenorrhea?
Yes.
Like I said, if you go to the hospital, there are certain questions which I mentioned, your age, your parity, and then the doctor would want to know the nature of the pain. When the pain starts, does it decline, does it get worse, or were you known to have a genital tract problem even before your onset, and then associated symptoms with your menstrual pain? Is there excessive menstrual blood loss? Is there diarrhea, and is it severe? And then is there fever? Remember I mentioned the toxic shock syndrome for those that might forget it, and it becomes a foreign body and forms a nidus or a severe infection. And then the doctor might want to do some investigations, like I mentioned, which will include some general investigations like the complete blood count, especially for those that have associated excessive menstrual blood loss. And then for those, that may present with symptoms suggestive of pelvic infection, the doctor might want to do a high vaginal swab or an endocervical swab for microscopy, culture, and sensitivity. And then the doctor might also want to do some radiological investigations like the simple ultrasound, and ultrasound to check if there is uterine fibroids, and then other pelvic pathologies or even congenital anomalies of the genital tract. The doctor might also want to go further to do some further radiological investigations if other causes like adenomyosis is suspected, like the magnetic resonance imaging, and then, like I said, for congenital uterine abnormalities, the doctor may also want to do a hysterogram. And then the doctor might recommend an operative form of investigation because of severe dysmenorrhea. You might want to do a laparoscopy to check if there is endometriosis and how severe is this endometriosis.
Thank you very much. So I like this next question, and the question is: can I prevent menstrual cramps?
A very interesting one indeed. I can see why you like the question, because yes, it's like I said, it's important to know that certain forms of menstrual cramps cannot really be prevented. If it's the very basic primary dysmenorrhea, which I said, of course, is self-limiting. Remember, I said most of them would stop with delivery of the first child. And then, so generally speaking, there are some lifestyle modifications that reduce the severity, or will even reduce, or might even help stop dysmenorrhea, like reducing the consumption of caffeine, avoiding smoking, and then, like I've said, exercise, yoga. You remember I talked about several reports in America which have shown that yoga reduces not just severity, can even help.
I think because it also helps to reduce stress
and relaxation. And then, like I've said, alcohol and smoking, and then getting one of the very, very important ways of preventing dysmenorrhea is seeking help. One would say, I don't want to have it at all. How does? Because if it is secondary dysmenorrhea and you seek help and the cause is found and treated, one becomes free of the dysmenorrhea. So very, very important. In fact, I consider it the most important way of preventing dysmenorrhea. If you're already having dysmenorrhea, to seek medical help.
So in other words,
In other words, if you come to Limi Hospital, we will help you prevent your dysmenorrhea.
That's a nice one. So if I should contact my doctor whenever I have any form of dysmenorrhea, if it's worsening and it was primary before, then also if I notice any of these symptoms, headaches, or my menses is getting heavier, or if I've done an investigation and I saw that there are some abnormal findings like on the ultrasound, or if there is a pathology, like you
Which
said,
you know.
I should make sure that I see my doctor.
Yes, very, very
So
important.
if you have noticed any of these things that I just said, make sure that you contact.
And I would want you to always add that one I said. Don't stay at home assuming it's primary dysmenorrhea.
Yes, so don't stay at
it's
home.
better you come. Let us evaluate
say
and say it with you.
Yes.
That is primary dysmenorrhea.
Yes. Thank you very much, sir. This has really been interesting. So, the next one is how can you say the pain of your menses is normal? Yes.
I've repeated it a couple of times. Okay, I want to repeat the last statement I said. Do not assume it is normal until you have come, we have evaluated, and we can now say it with you that your menstrual pain is primary or is normal. However, some things you might notice if you are very, very observant can help you have the knowledge to say, yes, it's most likely primary dysmenorrhea that I have. Like I said, onset, it starts around the period of menarche, and then even during the the beginning of the cycle itself, the pain starts, a few hours before onset of actual menstrual bleeding, and then it reduces or declines with further menstrual bleeding, and then may be associated with other symptoms like I said, diarrhea, mild lower abdominal discomfort, and then sometimes mild headache. So if it's typically like this, it is most likely. But when you know because over time a woman gets to know the degree of pain or degree of cramps she has during her menses. Once you notice any change, please seek help. And once again, remember, it is better to come, we evaluate, and we assure so that we can even join you in saying it that the pain you are having is primary.
So, next question is another question that I think we have resonated throughout this Instagram live, and that is, when should I contact my doctor? I think we've said that a lot.
Said it a lot.
For
emphasis, I want to repeat it. For emphasis sake, because for them to be asking the question means the person that asked the question may have missed out of that segment, yes, or did not follow out very well. But I said, even when you think your menstrual pain is mild, once there is a change, please seek help. Once you know that there is a pelvic pathology, seek help. Once there is an associated symptoms like increased menstrual blood loss, please seek help. Please seek help. Once you know that you already have a non-pelvic problem, please seek help. And then most of all, if we are not having pain during menses or cramps during menses, and you notice a new onset of cramp during menses, please, you need to seek help.
Okay, so there's a question here that was, are there drugs used to treat endometriosis? Can we treat endometriosis with drugs? Because I know that endometriosis is one of the commonest causes of secondary dysmenorrhea, as you say. You emphasize on it. So, are there actually drugs that can be used to treat it?
Yeah, actually, the treatment of endometriosis can be medical or surgical. Okay. The medical treatment is with drugs, and what these drugs mostly achieve is symptom relief. And the major symptom associated with endometriosis is severe dysmenorrhea or severe menstrual pain. Like I said, from the general normal non-steroidal anti-inflammatory drugs and to the hormonal drugs. And some of these hormonal drugs might just aim at even stopping the menses or inducing amenorrhea. Some of the drugs used to induce amenorrhea, and most of them are hormonal drugs. And then, like I mentioned, commonly used is the combined oral contraceptive pills, and then some of them the progestogens or progesterone preparations, which can be injectables or even oral medications. And then there are newer drugs which tend to stop the woman from menstruating. But the complaints about these ones is many of them are costly and have a lot of side effects associated with it. But the truth is there is medical treatment of endometriosis, but it will not completely stop the endometriosis because endometriosis in itself is a structural abnormality.
So next, another question. Is surgery necessary to treat menstrual cramps or dysmenorrhea?
Yes, surgery can be necessary depending on the cause and the type of patient and the severity. In fact, some surgeries if it's in secondary dysmenorrhea, the treatment is aimed at eliminating the cause. Like uterine fibroids, myomectomies. Once you remove the fibroids during myomectomies, it stops the pain or it abates the pain. And then in endometriosis, laparoscopic ablation of the endometriomas. And then in certain severe forms of dysmenorrhea, there are people have gone as far as doing what we call presacral neurectomy, denervation. That's why I didn't want to get to that about denervation. So it's a form of surgery that cuts off nerve supply to certain structures of the pelvis to reduce pain or dysmenorrhea, to reduce pain during menses or dysmenorrhea. Then other surgeries will include those to treat adenomyosis.
Can you give us some ideas what's the surgery?
I've talked about myomectomy.
Yeah,
I've talked about resection of adenomyosis. I've talked about laparoscopic ablation of endometriomas or endometriotic deposits. And then if there are other pathologies, one can also that are treated surgically.
This has really been a good discussion today. So if you want to give our audience something to take home, what will you tell
them? Okay, like I said, it is important for them to know that dysmenorrhea is a medical term for painful menstruation. Yeah. It's important for them to know that, and it is also important for them to remember that we said there is primary and there is secondary. And it's also important for them to know that we do not sit at home assuming we have primary dysmenorrhea. It is better for you to come to the hospital, get evaluated, so that we, the professionals, can even join you in saying it is primary dysmenorrhea. And then I want to also thank them for their time listening to us. Please do not forget, come for evaluation so that we can join you in saying it is primary dysmenorrhea, or if it is secondary, we'll find out the root cause and treat.
Thank you very much. Thank you very much, sir, for your time. We want to thank you, everyone on the live today, for joining us in this discussion. It has really been a swell time, and we hope that you did enjoy the discussion. Do have a nice weekend, and God bless.
Goodbye.